everyone, and welcome back to the Exhaustion Epidemic Summit, a free online series. I'm your host, Heather Russell, a health coach and herbalist, and I am passionate about helping women with their health and wellness so they live lives they love. This summit is where you will learn to move through burnout, exhaustion, and overwhelm to reclaim your self-confidence and step into your vivacious energy. Today, my guest is Dr. Carri Drzyzga. I am excited to have her on the show. Dr. Carri is internationally known as the functional medicine doc and the go-to expert on finding the root cause of health problems so you can feel normal again. Dr. Carri holds 2 medical degrees, chiropractic and naturopathic medicine, and also has additional training in functional medicine, the Bresdian Recode program, bioidentical hormones, acupuncture, the Kalish method, and is a certified gluten practitioner. As an avid learner, Dr. Carri has obtained a level of expertise in her profession that few doctors in Canada have achieved to date. And she hosts the regular podcast, The Functional Medicine Radio Show, and is author of the hit book, Reclaim Your Energy and Feel Normal Again, Fixing the Root Cause of Your Fatigue with Natural Treatments. And her private practice is in Ontario. Welcome to the show, Dr. Carri.
Hi, Heather. How are you doing today?
I'm good, thank you. How are you?
I'm good.
I'm grateful to have you on the show, especially since your books is specifically talking about fatigue. So you see a lot of patients who I'm sure, who are suffering from fatigue. Can you tell us a little bit about that and what you see?
So it's a very common problem, and I personally have gone through it myself. So I have my personal experience, and then just working with hundreds of patients. And what I do see some things in common, in the sense that a common story that I hear from patients is that they feel like their fatigue isn't being taken seriously. Mm-hmm. Now, I know our healthcare system in Canada is different in the US, but probably the listeners, the viewers have some things in common. So a lot of times I hear them, they just say, like, I don't feel like my doctor is listening to me. Like, they're not taking me seriously. They just think I need more sleep, or I need a vacation, or I need to take a break. But I know that there's something wrong. Yeah. I know it's something more than that. So that's a very common theme. And so what attracts patients to functional medicine, so for the listeners and viewers that are not familiar with functional medicine, I like to say, in a nutshell, functional medicine is find the cause, fix the cause, so you feel normal again. Yes. And so when it comes to fatigue, I like treating fatigue patients because they're always different. There's definitely a complexity to fatigue cases because there are so many different root underlying causes, and every fatigue patient is different and unique, like a snowflake.
I love that little snowflake principle. And it was funny that you just touched on, like, oh, you need more sleep and a vacation. Hey, we all need those things. So can you tell us a little bit more about, like some of the things that you witness that are like outside of that in your practice?
Okay. So I think a good place to start for the viewers and listeners out there, I like to just, see, how are you sleeping? Do you fall asleep okay? Do you stay asleep through the night? How many hours of sleep do you get? Do you wake up feeling refreshed? Or do you wake up feeling tired and you need more sleep? So right there, just talking about sleep, if the patient has issues with sleep, that needs to be fixed first. Otherwise, you will go nowhere. No matter how much adrenal support you take, no matter how clean your diet is, you have to get good sleep.
Why do you think we're all kind of not sleeping? I mean, if I don't go to bed by 11 and I'm a night owl, so it's a little bit, to me, it's like, oh, it's difficult. But, it's like, it just takes forever to fall asleep. And then I'm waking up and I'm like, no way is it 6 a.m. I think that we're all just kind of sleep deprived. And what is going on?
So there's a couple of things that I look for. So most of the time when patients come to see me, they're already more or less doing all the right things. So they're practicing good sleep hygiene, their room is dark, they have the electronics off, they're wearing an eye mask, they're trying to relax in the evening hours before they go to bed. They keep their room cool. So they're doing all of the right stuff.
Wonderful.
And so then I'm like, okay, what else could it be? So especially with women in their midlife, one of the big things that can impact their sleep is their progesterone levels.
Mm.
So when it comes to our hormones, progesterone is the first hormone that starts to drop. And progesterone starts to drop in our late 30s, early 40s is when progesterone starts to decline. And for some women, that's like a slow thing, and others it's like a steep drop. And one thing to keep in mind is progesterone is the building block for cortisol.
Okay.
So if you're under more stress, you're going to be using up your progesterone to make cortisol. And if you've been under significant stressors throughout your life, that's going to put you at more risk or more likelihood to having progesterone issues in your midlife. And so a very classic sign of progesterone deficiency or insufficiency is not being able to sleep through the night, waking up during the middle of the night, not being able to fall back asleep. Your brain turns on and you can't shut it off. That's very classic of progesterone deficiency or insufficiency.
Okay.
And so then how do we treat that? We treat that with sleeping pills, which makes no sense.
Mm-hmm.
Really, that should be treated by prescribing progesterone.
Yeah. That's so interesting. Yeah, because I don't know what it is about like our cultures, right? Where it's just, we want this fast fix. And of course a pharmaceutical is going to provide that for you, but it just treats a symptom, never treats the root cause, and actually makes your it makes it worse in the long run.
And I would say for a long time, I was anti-hormones.
Okay.
Because I didn't know much about hormones, really. I thought, you think you know it all and you don't. Yeah. You always get put in your place of you don't actually know it all. And the more and more I learned about hormones, I realized, okay, you cannot replace hormones with herbs. Mm-hmm. Using herbs to try and boost your hormone levels will never work. Okay. There is a point in life where you need to bite the bullet and start hormone replacement therapy. Okay. And I know that's a very controversial area. So like of all the areas of medicine, hormone replacement therapy is the one that's has the most confusion and misinformation in it, because most doctors aren't even really trained in hormones at this point anymore. Mm-hmm. And that's a whole other issue that we could even talk about. But all that to say is progesterone is the first hormone to drop. So that's one of the very classic signs of progesterone deficiency or insufficiency, okay. Waking up during the middle of the night. The other symptoms are just feeling more moody, more irritable, that it's harder to cope with stress, or just feeling more overwhelmed by stress, whereas years ago, that level of stress was like no problem. Now it is a problem, even little stresses. Some women will feel it as frank anxiety. Okay. They have this constant kind of worrying anxiety. That's a classic symptom of progesterone deficiency. Again, what do we do for that? We give antidepressants. No, we give progesterone because that's really the root cause of it. And then clinically, women might see changes in their menstrual cycles too. Mm-hmm. That their cycles are starting to become more erratic or irregular in length and timing, mm-hmm. and the amount of flow becoming lighter or heavier. Those are all classic symptoms of progesterone deficiency and insufficiency. And so the treatment for that is to give progesterone. And progesterone is a very safe hormone. Progesterone is a very safe hormone. So the research on progesterone says that it actually reduces the risk of breast cancer, amazing. Reduces the risk of endometrial cancer, increases the HDL or the good cholesterol. Mm-hmm. And progesterone in the brain helps your brain make more GABA aminobutyric acid. So GABA is the calming neurotransmitter in the brain. All the neurotransmitters are stimulating. GABA is the one that inhibits or calms. So as I said earlier, if you're waking up during the middle of the night, your brain turns on and you cannot turn it off, that's because you don't have enough of GABA because your progesterone is too low. So we treat that by using progesterone. Okay. And I know you're in the US, I'm in Canada. It has to be prescription. That's the only way to get physiologic levels up. Okay. And it must be oral progesterone. Okay. So progesterone cream does nothing. Progesterone sublingual drops does nothing.
Oh, really?
It has to be an oral capsule. And that's because as you swallow that capsule down, the progesterone gets absorbed out of the stomach and goes into the liver through first pass metabolism and becomes a metabolite called allopregnanolone. And it's that metabolite, allopregnanolone, that helps you sleep and stimulates GABA in the brain.
Amazing. So just a quick question then, just to go back to the hormone aspect and the sleeping. So because the summit, it really is geared for women, and, you know, a lot of the people I know are either perimenopausal or they're menopausal, and their sleep cycle has just been completely disrupted.
Yeah.
And right, because your hormones just totally take a dive.
Yeah.
Where can you can you just kind of talk about that with the sleep cycle just really quickly, and how progesterone might help that when they're like, if they had estrogen dominance as they're going into, like, how your hormones change really essentially when you go into peri or menopause?
Okay. So as I said earlier, perimenopause starts in our late 30s, early 40s, and that means progesterone is starting to drop. Estrogen is still going strong, but progesterone is starting to drop. And because estrogen is still going strong and progesterone is dropping, this is really classic estrogen dominance.
Okay. Yep.
And it's only once we hit menopause that then estrogen drops. And now you've got like no hormones in your body.
Then you
And
really need to be taking the, you know, progesterone, bioidentical progesterone.
yeah. And so women, so like I said earlier, we're all unique snowflakes.
Yes.
Different women will feel menopause and perimenopause symptoms in different ways. Like there are the classic hot flashes and night sweats. But some women actually don't have that, but they have like a lot of mood changes. They don't feel like themselves anymore. They feel a little bit like Dr. Jekyll and Mr. Hyde. They're wondering, like, where did the old me go?
Yeah.
And that can all be managed by getting the hormones back in balance. And then other women will have more like vaginal symptoms, vaginal dryness, painful intercourse. Some will feel it as they have a feeling like they're coming down with a bladder infection, but they never do. But that feeling, all of that has to do with estrogen loss in the area of the vulva and vaginal tissues.
Okay. I mean, that makes sense, right? Because when your hormones are imbalanced, right, of course, you know, your reproductive system is going to go a little haywire. And but I like that you
as things are changing, you'll feel it in your brain as well.
I was just going to say, and I liked how you were like, hey, you know, when your progesterone levels are low, you get the brain fog, the kind of confusion. You almost feel like scattered. Or I've noticed some women like are more prone to like ADD, ADHD. So can you talk a little bit about that? And
yeah, certainly.
Like,
so
fatigue, yeah.
So when it comes to our brain health, of all of the hormones, estrogen has the biggest impact on our brain health overall.
Okay.
So we know that once a woman hits menopause and their estrogen levels plummet and they have no more estrogen, at that point they are at higher risk for dementia and Alzheimer's. So that's been proven in the research. And we see this clinically because women, they'll have issues with their brain where they feel like their brain is getting worse. They're losing their edge. Their memory is getting worse, focus and concentration. And a lot of times women will just say like, well, that's normal. I'm getting older. And I'm thinking, no, that's estrogen deficiency. And if we don't fix that, you are at increased risk for Alzheimer's and dementia. Now, there's a lot of other factors that impact Alzheimer's and dementia, but we know during that period of life of menopause that estrogen can have a big impact. And the other thing that happens during menopause is once we lose those hormones, we also see an increased risk of bone loss. So women start to slowly develop osteoporosis. But as you're losing bone, you're also releasing heavy metals into the body. Yeah. And where do those heavy metals go? I don't know, they go everywhere, but they also go up to your brain. And so then that now compounds fatigue, memory issues, cognitive decline. And so when it comes to using hormones, so I think there's like of any area of medicine, really this is the area that has the most confusion and misinformation is about hormones.
Mm-hmm.
And so what women are not being told and what they should be told is, when you go through menopause and you don't have any more estrogen and progesterone, here's what's going to happen.
Mm-hmm.
You will be at increased risk for breast cancer. You will be at increased risk for endometrial cancer. You will be at increased risk for colorectal cancer. You will be at increased risk for dementia, Alzheimer's. You will be at increased risk for osteoporosis. You will be at increased risk for heart disease, which is the number one killer.
Mm-hmm.
And really, you're going to have a worse quality of life. That's what happens when you go through menopause and you have no more hormones.
Mm-hmm.
Do you want that? Or do you want to be put on hormones appropriately, which would lower your risk of breast cancer, lower your risk of endometrial cancer, lower your risk of colorectal cancer,
Mm-hmm.
lower your risk of dementia, lower your risk of heart disease, lower your risk of osteoporosis, and give you a better quality of life, and actually, on average, live 3 years longer, healthier than if you didn't have hormones. So it's like, what group do you want to be in?
Suffering for a long period of time, or right? Because there's no getting around that.
There is a great book out there called Estrogen Matters by Avram Bluming and Carol Tavris. It's an excellent book. I recommend all females read this book because it explains hormones in very simple language. From the research, it explains the research in very simple language. Because at some point, you're going to have this decision to make.
Mm-hmm.
And you want to make it having all of the knowledge and making what we call in the medical world an informed choice about your health care. Do you want to go down this path or do you want to go down that path? And so many women are scared, but they also feel like crap and they want to feel better. And they just don't know what to do and their doctors really aren't helping them. That's an excellent book to read, as Estrogen Matters.
Thank you so much for that recommendation. I'm
Sure.
definitely going to pick up a copy of that book. So can you also talk to us about like other systems that are affected in your body? Like we've talked about the brain and our reproductive system, right? That takes a total toll when we are under like chronic stress and inflammation. What other area in the endocrine system like that really kind of puts a toll, like depletes minerals and just like makes us completely out of balance, where we think we're crazy and it's not us being crazy?
Well, if we kind of go on this along this journey of sleep, because if you're feeling tired, and it could be because you're not sleeping well, let's fix your sleeping and then you'll have more energy. So the other thing that I commonly see in sleep is that we do a trial of melatonin.
Mm-hmm.
And so here's the thing with melatonin, because probably a lot of the viewers and listeners have already tried melatonin and they said that didn't really help. Yeah. And I would say, well, here's why it didn't help. Melatonin has a half-life of 2 hours, which means you take your melatonin 2 hours later, half of it is already metabolized and out of your system. So it can help you fall asleep, but it will never help you stay asleep. Mm-hmm. So one of the things that I have a conversation about with patients, along with progesterone, is melatonin.
Yeah.
That we can use melatonin, but we want to use it in a time release formula. And we just want to dose it to the effect that you sleep through the night really well. Whatever that level is, I don't really care. Melatonin is a really powerful antioxidant and anti-inflammatory in the body. So it helps us sleep, but it also has these other impacts on our health, which are positive.
Mm-hmm. I like that. And the combination of the two, like one puts you, like helps you go to sleep, and the other one helps you stay asleep and you're not mm-hmm. restless and getting up in the middle of the night.
So oftentimes that's where I start. Because like I said, if the patient is not getting good sleep, you're going to hit a wall. You can supplement them all you want with adrenal supplements, with vitamins, work on their thyroid, like you will only always get so far. So I always want to start with optimizing sleep. And the other tidbit with sleep is, for a person that wakes up after like 8 hours, 9 hours, 10 hours of sleep, and they wake up feeling exhausted, they might have a sleeping issue that needs to, so they might need a sleep study
Okay.
to see if they have a diagnosable sleeping issue like apnea or something like that.
Oh, that's that, obviously that would be something to look at. That's really good information.
Mhm.
So sleep is the first thing that you look at. Obviously, we're missing a lot of sleep. I like that you talked about, you walk through your patients like it needs to be dark, maybe no screen time, don't have a television in your bedroom, really, because it sets really the tone of your health. Like you
Mhm.
said, you could be eating all the most amazing things, have amazing relationships. But if you're not sleeping, that completely imbalances you in every single system.
Mhm. Then the other hormone that I like to talk about is thyroid.
Okay.
And so there's a couple of things to think about with thyroid. Well, I mean, we could have a whole conversation about thyroid, and I know we only have so much time. Okay, so for patients that already have a diagnosed thyroid condition and they're on thyroid medication,
Mm-hmm.
which is typically Synthroid or an analog of Synthroid, Eltroxin, something like that. It's a T4 medication.
Okay.
The active thyroid hormone is a T3. So there's actually research on this that patients that are on these T4 medications, Synthroid, et cetera, the typical medications that are prescribed,
Mm-hmm.
upwards of half of them are frustrated because they still have very obvious symptoms of hypothyroidism, fatigue, weight issues, cold hands, cold feet, constipation, dry skin, thinning, hair falling out.
Yeah.
And they go to their doctor and they have their blood work done, and the doctor says, well, your numbers look good. I'll see you next year. Yeah, doc, but I don't feel good. I still feel like I have hypothyroidism. No, you don't. Your numbers are good. I'll see you next year. Yeah, but I don't feel good.
Right.
Like I've done some research and I want to feel better. I think we need to change my medication. No, your numbers look fine.
Mm.
You need a vacation or
Your numbers. Yeah.
So so looking at the numbers really, and this is true of any test result, it only tells us so much. It only tells us part of the story, but especially with thyroid, the numbers, what they're not telling us is what is happening at the cellular level. Is that thyroid hormone binding to the receptor properly? Is there a receptor binding issue? Is there a mutation? Is there intracellular signaling issues? All the numbers can look beautiful, but we don't really know what's going on down deep at the cellular level. And in my opinion, if a patient is having thyroid issues, thyroid symptoms,
Mm-hmm.
even if they're on medication, that they're either not on enough medication or they need to change to a T3 based medication. So in the research that they did, so they did this huge study on patients that were on Synthroid or the analog,
Mm-hmm.
and upwards of 50% were unhappy because they still had symptoms. Well, what they did was they switched them to desiccated thyroid. And desiccated thyroid is a T4 plus T3 medication. And my goodness, guess what happened, Heather? They got better. They felt better. So their energy came up. They felt warm again. Their hair stopped falling out. It started growing again. They just felt more like their old self. And so sometimes with patients that are coming in to see me and they have fatigue and I see, oh, they're on typical thyroid medication, we'll have a conversation about that if they're still having a lot of symptoms. And if I have a patient that has a lot of symptoms but is not on any medication, even if their numbers look really great, it's like, well, you have symptoms. That is telling me something. So I think part of what's happening in medicine in general is medical doctors are becoming like technicians. You get a test result, you look at the number, you deem it good or not good. But we're losing is the art of medicine, which is listening to the patient and what their symptoms are telling you. Because the symptoms tell a story too. And if the symptoms say, I have a low thyroid, I'm going to do a trial of using desiccated thyroid. And if the patient gets better, well, I'm on the right track.
Mm-hmm.
But I also have had that happen where the patient doesn't get better. And it's like, okay, well, maybe it's actually not your thyroid. It's something else. Let's roll up our sleeves, dig deeper, and see what are we missing.
Mm-hmm. Yeah, like you said, everyone is a snowflake. So that's why I think it's like
Yeah.
really important that we have, physicians like yourself, naturopaths, functional medicine practitioners, right, who really balance that out. Because conventional doctors really, you were talking about listening, they listen to you for 5 minutes, you complain about these symptoms, you're probably going to go and ask them about a medication that you saw on TV. I don't know when this became legal. And then, they just write you a script. And I love that you're talking about like glandulars. And if it's a concept that maybe the audience hasn't heard before, can you just describe it a little bit? Like the desiccated.
So desiccated thyroid, so that's considered a glandular medication. They derive that from a porcine source, which means they get that from a pig thyroid.
Yeah.
And it's purified and whatnot. And it's a specific ratio. I think it's a 4-to-1 or a 5-to-1 ratio of T4 to T3. T3 being the active thyroid hormone. So that's where the rubber hits the road.
Mm-hmm.
And so that's more in line with what your human body should be making versus the typical synthroid or synthroid analog, which is only T4, relying on your body to convert the T4 to T3, which oftentimes, well, I guess I say oftentimes because those are the patients that come see me. I don't, healthy people generally don't come to see me, but every once in a while, one comes in the door. And when I actually test patients for their zinc levels, so you need zinc as a mineral to convert your T4 to T3. So from inactive thyroid hormone to active thyroid hormone, one of the cofactors is zinc. So I routinely test zinc levels in patients. So that's a simple blood test done at any lab. And very commonly, I would say upwards of 90% of the time, zinc levels are inadequate. So we know that that's part of the puzzle, but it's been my experience that just giving patients zinc rarely works at boosting their energy. Ultimately, you need to, if it's thyroid, they need the medication change.
Mm-hmm. Yeah. Well, I mean, what is the deal here? We just think that there's going to be one magic pill. Oh, I'm going to take zinc. I'm going to eat extra shellfish, right? Because that's high in zinc. And I always laugh like, well, your body doesn't just only take in one mineral at a time. So I always find it fascinating.
Well, it's something, it is a valid concern. So there's kind of two schools of thought. So one school of thought is, well, let's do things one at a time. And that way we can see what is working and what's not working.
Mm-hmm.
But the problem with that is there's usually multiple things that needs to be done all at once in order for a shift to happen in the body. And if you take things one at a time, it's a slow road to go. Patients get frustrated and they think it's not working, but it is. And then the other school of thought is, well, let's do all of this all at once. Yeah, we're not going to know if what exactly is changing, but you're getting better.
Mm-hmm.
Like, here are your options. You're the patient. Here are your options.
Yeah.
What road do you want to take?
Yeah.
So I am a real big believer in practicing and giving my patients options and saying, like, I'm not here to make the decision for you. You're an adult.
Mm-hmm.
Here are your options. What do you feel is the best for you? I'll support either option. I'm here to help.
Amazing. Not pushing any. And it's like with the invention of the internet, and we have WebMD, and people were like, hey, that sounds like me. And then they start kind of taking it themselves, which is kind of what I was saying, like, oh, well, I think I'm zinc deficient because of all of these symptoms. I'm going to take zinc. And then you never really get into a root cause because you can't self-diagnose yourself.
Yeah. So you know what? You bring up a really good point is that I find in general, the internet has a lot of great information on it, but things are really overly simplified. And patients think, well, I'll just do this and that and I'll be fine. No, what's on the internet is not like a real life patient. A real life patient is complicated.
Mm-hmm.
There's the complicated physiology that's happening inside, and then there's all that external stuff that's coming at them, the stress, the toxins, all that whatnot. And so I think a lot of patients are frustrated, you know, they roll up their sleeves, they do the research on the internet, they're making changes. They're like, I'm not any better, Dr. Carri. And I say, well, yeah, it's not as easy as you think. There's a lot of factors. And it's like a constant chess game that we're playing. Okay, I'm going to make this move now, but I know if that doesn't work in the future, I'm going to make this other move. But if that does work, then I know I need to make this move.
It's a little puzzle, putting the pieces together.
It is a puzzle.
Wonderful. So I like that you talk about sleep and how like you need to go get a prescription for bioidentical progesterone. That's a great tip. You know, for our listeners to know, like, hey, there is an end in sight to this. I need to go talk to my naturopath, my functional practitioner, and get on a bioidentical hormone. I know that Premarin, which is not progesterone, right, but it was estrogen, and I know that it was like got a really
so years ago in the 50s, they came out with Premarin, which is a synthetic estrogen that they get from pregnant mare's urine, which is Premarin, and then within the next 10, 20 years, they saw a huge increase in the amount of endometrial cancer in the female population. So then they realized, okay, we can't just give Premarin alone. We have to buffer it with, at that point, they used Provera, which is a synthetic progesterone. It's actually a progestin is the technical term. And it's getting that balance between the progesterone and the estrogen that's what helps protect you from endometrial cancer. But then in 2002, they did the big study, the Women's Health Initiative, which was a bit like $1 billion study in the US. And in 2002, the results came out, and basically they stopped the study short.
Okay.
And they basically, like overnight, they just told women worldwide, like, you need to stop your hormones. Hormones are bad, and they're killing women, and they're causing strokes, and they're causing cancer, and all this stuff, and you need to stop. So that was 2002.
Okay.
And now what we know since that study was done, and other researchers have looked at the study and the methodologies they used and the group of women that they used for the study, is what they now know is that was a really crappy study that was done. Pretty much all of that study has been refuted.
Good.
And that study probably should have never gone to publication. It was so bad. And yet, Heather, when it comes to hormones, doctors, the first thing they think about is that study. And they think, well, hormones are bad. And it's like, no, you need to get on top of the research, because there's an abundance of research out there showing that. And when I say hormones, I mean estrogen, like what your body makes, estradiol, and progesterone, what your body makes, that there is an abundance of safety. Sure, we have to be careful of endometrial cancer, but that just means prescribing progesterone appropriately on top of estrogen. That's a simple thing to prevent. And that there's an abundance of benefits of having hormones in your body, and then the risks of not having hormones in your body. So like I said, the book, Estrogen Matters, is a great book at explaining that research so that your audience can feel more confident in making these decisions moving forward. Because at some point in your life, you will hit perimenopause and menopause, and then you'll be in postmenopause, and you need to know what's happening to your body and take charge of your health.
Yeah, like you said, it'd be an informed patient. And, you know, when you were just exhausted constantly and you're not sleeping, you know, there is a root cause to that. And it's not, you know, you don't get into that kind of a situation like overnight, and you're not going to get out of it overnight, but really working in tandem, you know, with an experience like naturopath is like, it's a great little relationship, because it's the root cause and not symptom based.
Exactly.
So we have a couple of minutes left. I would love for you to tell viewers how they can get a hold of you, and then have you talk about your generous free gifts.
So I guess where your audience can find me, I have 2 websites. So for my private practice is functionalmedicineontario.com. And then I have a website called drcarri.com. So that's drcarri.com. And that's where I have my blogs, my podcast episodes. And of course, you can find my podcast online, the Functional Medicine Radio Show. And then my book, thank you for letting me offer this to your audience, is actually a free copy of my paperback book, Reclaim Your Energy and Feel Normal Again, Fixing the Root Cause of Your Fatigue with Natural Treatments. We just ask that you pay for your shipping and handling. So the book is free, but you still have to pay for shipping and handling. And in that book, I outline 8 of the fatigue factors. In reality, there's like 20 fatigue factors. I outlined 8 of them in the book, but that's a good place to start.
Yeah. The 21, it would be like, oh, overwhelm. So that's really generous of you. Thank you. Thank you so much. Appreciate that. And I'm going to have all of Dr. Carri's information and then information for the free gifts and her podcast down below our interview. And then I have my question I would love to ask. I ask almost all of the experts, is I would love to know, as a woman and you're super busy professional and have a life outside of your practice, what do you have, like self-care rituals? What is your self-care routine?
Oh, so one of the things that I love to tell patients about is that I do boxing and kickboxing. So I, like most people, don't like exercising. And for years, I really didn't do much exercising above and beyond walking my dogs every day. So I have 2 Basset hounds. They're my fur babies, and they get a good 3-4 mile walk every day. But above and beyond that, I wasn't doing much. And then at one point, I got an email from a friend of mine, and she said, "Oh yeah, I'm going to this boxing class tonight." And I was like, "Really? You know, that sounds interesting. I'd like to try that." So I tried this formal boxing class, which was just a small group of us, and we were just hitting the heavy bag. We weren't like sparring or hitting people. And so there was a couple of things that I got out of that. So one is that you have to really focus on how you hit the bag, otherwise you're going to hurt yourself. But the amount of focus helped shut my brain off.
Amazing.
And so that was good because it's hard. I have a hard time shutting my brain off. So that right there was a plus. And then actually hitting the heavy bag, it's like I found this inner power that I didn't even know was there. And I was like, I'm a badass. I'm really not, but like you have that. It's like, wow, where did that come? That's been there the whole time. And so we got to the end of the class, and it was like, whatever, 45 minutes long. And I was like, what? Well, that's it? Well, can't we just keep going? This was so much fun. Yeah, we'll see you on Thursday. So I started doing that, and so now I go to 9 Round, which is a franchise. I know they're available all through the U.S. and there's other things like similar, but you go in anytime, and the routine is different every time. But it's basically boxing and kickboxing. So I really like. It really helps me get out my frustration and my stress. And like I said, it's just very empowering. So it really helps build self-esteem. I've heard that from so many women.
I love that.
So I do that routinely, and I have to, or I will not be pleasant to be around.
You not pleasant, come on. Well, thank you so much for sharing that with us. I appreciate you being on the show today and offering all of your expertise. And to our viewers, thank you so much for tuning in, and I'll see you tomorrow. Thank you, Dr. Carri.